Today, we'll be discussing the toxicology of amphetamines. Amphetamines are potent central nervous system stimulants commonly prescribed for ADHD and narcolepsy, but they're also frequently encountered in the emergency setting due to overdose or misuse. We'll explore the mechanism of action, clinical symptoms of toxicity, and approaches to treatment. Let's dive in. Regarding the mechanism of action, amphetamines, including substances like dextroamphetamine, methamphetamine, and MDMA or ecstasy, primarily act on the central nervous system by increasing the release and inhibiting the reuptake of catecholamines, such as dopamine, norepinephrine, and serotonin. Here's a closer look at their action. Release of neurotransmitters. Amphetamines enter presynaptic neurons through the norepinephrine transmitter and dopamine transporter. Inside the neuron, they disrupt vesicular storage by inhibiting vesicular monoamine transporter, VMAT2. This leads to increased intracellular levels of dopamine and norepinephrine. The elevated levels cause the neurotransmitters to be released into the synaptic cleft by reversing the action of the norepinephrine transporter and dopamine transporter. Inhibition of reuptake. Amphetamines also inhibit the reuptake of dopamine, norepinephrine, and serotonin, which increases their concentrations in the synaptic cleft. This prolonged presence of neurotransmitters at the synaptic cleft enhances the stimulation of postsynaptic receptors. Sympathomimetic effects. Amphetamines have significant sympathomimetic effects. The increased norepinephrine stimulates alpha and beta adrenergic receptors, leading to systemic effects on the cardiovascular and peripheral nervous systems. This enhanced stimulation results in the characteristic euphoria, alertness, and increased energy seen in users, but also underlies the toxic effects seen in overdose situations. Now, regarding the clinical presentation of amphetamine toxicity. The clinical signs and symptoms of amphetamine toxicity can range from mild to severe, depending on the amount ingested and individual patient factors. The central nervous system symptoms. Agitation, restlessness, confusion are common. Patients may become delirious or even experience psychosis with hallucinations and paranoia. Seizures can occur, especially with large doses, due to the intense stimulation of central nervous system. Hyperthermia is a critical concern, as it can lead to rhabdomyolysis, disseminated intravascular coagulation or DIC, and multi-organ failure. Regarding the cardiovascular symptoms, amphetamines cause tachycardia and hypertension due to their adrenergic effects. Severe cases may progress to cardiac arrhythmias, myocardial ischemia, or stroke due to the significant increase in blood pressure and vasoconstriction. In chronic users, cardiomyopathy can develop, leading to heart failure. Other systemic effects. Mydriasis or dilated pupils is often seen, along with diaphoresis or sweating and dry mouth. Gastrointestinal symptoms such as nausea, vomiting, and abdominal pain are common. Severe intoxication may present with metabolic acidosis, hypokalemia, and rhabdomyolysis, especially if hypothermia and seizures are present. These symptoms can be life-threatening, so early recognition and treatment are essential. The management of amphetamine toxicity primarily focuses on supportive care and addressing the complications that arise. Here's the approach. First, the initial assessment and stabilization. As always, begin with the ABCs: airway, breathing, circulation. Monitor vital signs including temperature, heart rate, blood pressure, and oxygen saturation. Establish IV access, and initiate cardiac monitoring due to the risk of arrhythmias. Cooling and seizure management. For hypothermia, initiate aggressive cooling measures such as external cooling with ice packs, fans, or evaporative cooling techniques. Benzodiazepines are the first-line treatment for agitation and seizures. They help reduce the CNS stimulation and can aid in lowering body temperature. If benzodiazepines are inefficient, barbiturates or propofol may be considered in refractory cases. Blood pressure and cardiac management. For hypertension and tachycardia, benzodiazepines may suffice. But in cases where blood pressure remains elevated, consider using phentolamine or nitroprusside. Beta blockers should be avoided due to the risk of unopposed alpha-adrenergic stimulation, which could worsen hypertension. For arrhythmias, treatment should be guided by ACLS protocols. Management of rhabdomyolysis and metabolic complications. Monitor creatinine kinase levels and manage rhabdomyolysis with aggressive IV fluid administration to maintain urine output and prevent acute kidney injury. Address electrolyte abnormalities such as hypokalemia or metabolic acidosis as needed. And psychiatric considerations. Patients may experience psychosis or severe paranoia. Antipsychotic medications like haloperidol can be used for agitation, but should be balanced against the risk of worsening hypothermia. Consider psychiatric evaluation once the patient is medically stable, especially in cases of intentional overdose. To wrap up, amphetamine toxicity can present with a range of serious symptoms, from agitation and seizures to life-threatening hypothermia and cardiovascular complications. Early recognition and rapid intervention are key to improving outcomes. Supportive care remains the cornerstone of treatment, with a particular focus on controlling agitation, managing cardiovascular effects, and preventing hypothermia. Understanding the underlying mechanism of amphetamines allows us to tailor our approach and better manage these challenging cases. As always, keep your head up. You're doing great. You're better than what you were yesterday. That's a lot. Learn something new today. You're going to be a great doc. Sometimes you just got to hear that. Are you an emergency medicine professional or a medical student eager to sharpen your toxicology skills? Well, look no further. EM Toxicology Trainer is your go-to app to mastering the essentials of toxicology and toxicological emergencies. With EM Toxicology Trainer, you can dive into the mechanisms, symptoms, and treatments of common overdose scenarios right at your fingertips. Learn what happens in the body when venlafaxine levels go too high, or how to handle a dangerous Tylenol overdose. Our app makes learning toxicology easy, with concise explanations that reinforce your knowledge to go. No more scrambling through textbooks or online searches when time is critical. Whether you're in the ER or prepping for exams, EM Toxicology Trainer gives you the confidence to tackle toxicology cases with precision and speed. Download EM Toxicology Trainer today and become the expert your patients need when it matters most. Available now on iOS and Android. on